Hello and welcome to the web series ZeroPM Pieces. In the ZeroPM Pieces, the researchers in the project will tell you about one piece of the ZeroPM puzzle that they're working on. So without further ado, here comes a ZeroPM piece.
So, hi, I'm Ellise Suffill. I'm at the University of Vienna, working in environmental psychology. And today I'm going to talk a little bit about how we've tried to integrate social data into the discussion of PFAS, its risks and benefits, with a particular focus on the essential use concept. So I think the nice thing for this audience is I don't have to give PFAS too much of an introduction. Obviously, it's very widely used, and due to its mobility, it's now a very widespread pollution problem, which is only going to continue to accumulate unless we find ways to reduce the emissions of PFAS. However, when we speak to experts in PFAS, what we see is that the comparable risks of drop-in alternatives to PFAS, this is one of the biggest barriers to potentially the EUC and also to the successful substitution of PFAS. So perhaps more radical substitutions are needed, wherein we either change the way a function is provided, or we say we actually need to kind of do away with the use of these potentially harmful chemicals in the first place. However, when we're making these kinds of more radical changes, wherein we say, okay, we're going to just say we don't need something to replace PFAS because perhaps we never needed that level of performance or that level of durability in the first place, it's good to back this up with social data, wherein we can say, for example, particularly from consumers, once they're informed about PFAS, they know they've weighed up the risks and the benefits, and they say, I'm happy to accept a different kind of product that, for example, doesn't need this level of performance, doesn't need to look a certain way, etc. Now, those who have heard me speak before will say that we have lots of evidence of the environmental and health impacts of PFAS, but at the time of the project's beginning, we were lacking social data. So we didn't have a good social database of what people know and don't know about PFAS, why they're most concerned, and what kind of actions they're willing to take or support to reduce PFAS pollution. So there's 3 steps that we follow overall, where we try to go out there and first describe what different groups know, think, and why. And this is because the public are not homogenous. There are different subgroups within society. Then we can try to kind of tailor our communications towards people on the basis of their knowledge and beliefs. And we can try to also anticipate where there might be potential opposition. For example, if a government decides to enact a restriction on PFAS, wherein it changes something perhaps that people come into contact in daily life, or it changes the cost of some kind of service, and you say we're doing this to protect the environment, that might work well for people with very biospheric values who care about the environment, but it might meet opposition from those who, for example, don't believe that the environment is a priority. And in that case, we may need to tailor, for example, the communication towards the benefits for health or something like this. So that's our overall strategy. And I'm going to talk about kind of 3 different ways in which we've tried to look at social data in the context of PFAS and the EUC. The first one is a rapid review that was actually done with the Dutch Health Ministry, RIVM. And this is where we tried to look at if there is any existing work out there in different fields, different disciplines, that has tried to come up with a set of rules about what makes something essential or not to a kind of modern standard of living. Then I'll talk about qualitative interviews, and this is where we sit down with a small number of experts and non-experts, and we try to dig into the psychological mechanisms behind where some beliefs are coming from. And lastly, I'll talk about quantitative representative surveys, wherein we say the kind of things that we've identified so far, how widespread are those across the public? So to begin with, the rapid review of existing concepts. As I say, this was done in collaboration with RIVM. My colleagues at Uni Wien, Adi Waller and Johannes Peter Mandel, they had a snowballing approach where they were basically, each time they encountered new kind of terms which could be relevant to some kind of concept or framework, they kind of expanded the terms that were included. So, for example, think about things like minimum decent living standard, material deprivation, basic human needs. These are all kind of concepts that exist in the world already, that have some kind of framework to decide when something should or shouldn't be essential. Despite all of the papers that they went through, it resulted in kind of 25 being more or less useful for an analysis, in which they then tried to compare the EUC's framework to these existing frameworks, which is not an easy task, as I'll get to in a few slides. Overall, they found that the EUC remained quite theoretical and doesn't technically have empirical validation for whatever reason. Now, these are the kind of main themes that they identified in these circles. So the bigger the circle is kind of how often it came up in the literature. When they have this black band around them, so the black circle, this is something that they deemed to be kind of more consistently or concretely defined. But we also have some more fuzzy concepts. Now, there are lots of similarities to what we would expect to be protected under the EUC. So things like health, living conditions, communication, transport. But there are some differences too in these more fuzzy, less defined concepts. For example, financial security, whatever that means. But of course, the EUC, approaches it from, we cannot allow essentiality to be defined just by economic gain, which makes sense. But we also have this aspect of financial security in these other concepts. There's also more kind of psychological things, so enjoyment, social needs, which of course is not currently captured by the EUC, given that the EUC is applied at a much more specific level. And this just comes back to the difficulty in kind of trying to look at what's out there, compare it to the EUC, because they are applied at such different levels and different levels of specificity. Some more key differences that they found are the kind of direction that you might approach a problem from. So we can see that the EUC is primarily a harm avoidance stance. We need to try and reduce the negatives coming from pollution of substances of very high concern. Whereas some of these other concepts are approaching it from promoting positives. So how do we get the biggest net gain from X, Y, Z? I think the biggest kind of difficulty in comparing, but something that also makes sense, is this essentiality versus essential use. So as I've kind of touched upon already, one really hard thing to even compare what's out there already is they are so much more general. They're looking at whether a good or a service is essential, not whether the use of a chemical in that is essential. And that, while we can kind of find some commonalities, like, protecting health, protecting transport, protecting communication, etc., it does make it really hard to compare them because they are just not, intended for the same purpose as the essential use concept. Lastly, in terms of non-essentiality, the EUC is quite binary. Something that fails conditions A to E is non-essential, whereas other concepts are not so exhaustive. They can also be a kind of spectrum. If we think about material deprivation, imagine there are 5 categories that you should have access to have a good life, or something like this. It might be if you have 4 out of 5 of those categories, you're not considered materially deprived. But in another part of the world, given the living standard of the average person there, it could be 3 out of 5, and then you're not considered deprived. So this also, as well as reflecting the fact that not all of these systems are binary, it also shows us that there can be variation given the standard upon which you're used to in different regions of the world. Perhaps for the EUC, this might mean that what's considered essential here or there might vary on the basis of what people expect. Lastly, they looked at some ways to try and, from the literature, where the people had tried to validate the kind of categories that they'd come up with. Now, not all of these are super useful, so philosophical analysis and impossibility of just not having access to something. But for example, some things are maybe what more kind of we would already consider within kind of chemical substitution. So technical analysis. I mean, here we have a car, but let's say it's like PFAS in the battery of a electric car, something like this. Can we replace that with a drop-in alternative or something like this? So that's quite similar to technical analysis. Negative rationale, maybe if we had the use of PFAS in pacemakers, if we remove some PFAS from pacemakers, actually, does that lead to a bigger negative for the patients than it does for the reduction of pollution? Yes, then that would fall under negative rationale. We would say we would keep using it. Lastly, the one that was most interesting for us was democratic opinion. So in some of these frameworks, they tried to say, can we use public opinion when people are at least informed about things, to say if more than half of people, for example, say that this, yes, is an essential use, or no, this isn't an essential use, then it doesn't fall into the category of essential. And that's something that hadn't potentially been looked at with the EUC, which was something we were interested in. So now I'm going to move on to the qualitative interviews. And this is where we sit down with a small number of experts and non-experts, and we try to dig into the beliefs and the reasoning behind those beliefs. And I think one thing that's really important from this kind of work is that we can build a sort of general mental model of experts, so what they kind of agree on and what's the state of the art in the field. Then the non-experts, the same thing again, and we can look for key misconceptions across people. So one really important thing from this paper was that we found that non-experts really fixate on the use phase. They think, I use a non-stick pan, I scratch it or I burn it, it goes in the food, I've eaten PFAS, or I have a recycled plastic bottle and it's degraded and the PFAS goes into the water and I drink from it and now PFAS is in my body. They really underestimate the emissions from production and disposal. So as long as we continue to, keep using PFAS in the way that we are, even if they avoid using or buying and using products with PFAS themselves, we need to better communicate the kind of circularity of the issue in order for them to understand that, there needs to be a systemic change, not just what choices they make as consumers, for example. In terms of essentiality, this is, of course, the tricky bit. The non-experts, quite rightly, when you ask them which of these products serve essential functions and why, and these are everyday products like pans again, TVs, mobile phones, period products, nappies, etc., they quite rightly say, well, essential use is the use of the chemical in the product, not the product itself. But in order to get non-experts engaged on the topic, we have to say, first of all, what products are essential, what functions of them make them essential, and then kind of extrapolate, do we actually even need chemicals like PFAS to meet that function, yes or no? To talk about what kind of themes come out in terms of making something a function essential to people, they said things like, for makeup, this is something which many people will say non-essential, other people will say it's essential, and that's the product level, so it isn't that relevant to the EUC, but for whatever reason, people say that the makeup is essential to them because they use it on a daily basis. Some people use it for work, and it's also again linked back to these social and psychological aspects like well-being and perception of self. And then it's perhaps not surprising that we see from some industry similar themes emerging in their stances on the EUC. So here we have a Cosmetics Europe quote, and it says 72% of consumers said that the cosmetic and personal care products they use improve their quality of life. Therefore, any concept of essential use of chemicals should take a holistic approach, including the value to society. And yes, sure, if you ask people, are hygiene products important for you? Yes, they will say yes. But that does not mean that they want PFAS and other potentially harmful chemicals to be in those products. And I think this is where social data can be quite important, because we have the chance to not only ask people how important products are to them and then stop, we can say, here's some information about the kinds of chemicals that are being used in those products. Now, how acceptable do you think it is for that product to be used there? And actually what we see is that products which are rated with high essentiality, including personal care products, often have low acceptability for PFAS to be in them. So these are people's ratings, including things like, personal care products, makeup, dental hygiene, also period products, anything involving vulnerable groups like children, so nappies. So high essentiality of the product does not mean high essentiality of PFAS. Often these things can be decoupled once we actually inform people in a balanced way about the risks of PFAS. Lastly, I'm going to talk about our quantitative surveys. And so far, we've looked at Sweden, Germany, and the Netherlands. And these samples are interlocked by gender and age to represent each nation's demographics. This is how we tried to operationalize the EUC. So this is based upon the European Commission's most recent communication on the essential use concept. And we've kept the kind of synthetic split between necessary for health and safety and critical for functioning of society. We've kept each of the use categories, but we have to some extent had to try and simplify the examples given under each to try and make them a little bit more digestible to your average person. And we're asking people about the acceptability of continuing to use PFAS in each of these scenarios. Of course, we include other measures. So how concerned people are about PFAS. This is an aspect of risk perception. And this is also, we asked them specifically about concern for the environment, concern for themselves, their own health, and concern for health in general. We also asked them about their willingness to change their own behavior, and this is basically focused upon mainly consumer things, so avoiding products with PFAS, paying more to avoid PFAS, accepting a lower level of function, etc. Policy acceptance support, so this is a range of push-pull policies to reduce PFAS pollution. We also looked at things like their support for labelling, which was generally very high, so labelling products that contain PFAS as a mandatory thing, and more biomonitoring. We included a measure of policy urgency, so how soon do people want a broad restriction of PFAS? And this is to reflect the different sundown periods that were offered in the PFAS restriction proposal. Trust in authority, so this is how much people trust their national national bodies to competently regulate chemicals. And lastly, we include things like covariates of the individual, so age, gender, political orientation, etc. This obviously allows us to control for some individual differences, but it also allows us to look for groups of people, subgroups in society that might be responding a certain way compared to others. So I'll start off by saying that despite including 3 countries who are involved in the PFAS restriction proposal, awareness of PFAS was still very low. So 2 out of 3 people reported never having heard of PFAS. And those who said they had heard of it had very low knowledge. So they said, yeah, I've heard of it, but I basically don't know anything about it. After being given basic information on PFAS risks and benefits, concern was very high, so about 5 out of 7, and that's for both environment and health. And overall, people support a restriction sooner rather than later. So that's what we have in the bar chart here. And you can see there's a left skew, and that's people wanting it dealt with, wanting a broad restriction sooner rather than later. What I think is quite nice here is that the majority of responses, I mean, of course, amalgamated across the countries, but the majority of responses fall within by the end of 2030. So when this was done, you know, people weren't silly. The majority of them weren't saying by tomorrow. They know these things take time in order to put in place the changes. But they're saying, despite that, within 5 years is preferable to within 12 years. And I think that's important to feed back. In terms of the tricky bit, again, the different use categories for the EUC, similar to Corinna et al.'s work, we don't see clear winners or losers on what should be considered essential or not, or how essential it is to keep using PFAS in those scenarios. I mean, we can see potentially some mild variation between countries, but it's very difficult. You know, we can see that people don't really know whether it should be yes or no. In addition, 250 respond to each with I just don't know, again, reflecting the complexity. What I will say is if instead of having it like means here, if you look at the skew of things, where the majority of responses are falling, quite a lot of people are saying lower support for the use of PFAS in sustaining basic life and health conditions and protecting the natural environment. And that might seem bad off the book. That's like, oh, that's not a great thing. But actually, if you've just told people, okay, well, PFAS as a pollutant can have bad effects on health and PFAS can damage the environment. And then we say, okay, but we sometimes need to use it to protect health and to protect the environment. There's a cognitive clash there. And I think that's why we're seeing, when you look at the data in certain ways, that's where you're seeing a kind of lower acceptance there. And that's maybe where we can then try to target improved communications of why we sometimes do need to, where the benefits actually outweigh the risks for once in order to protect health, for example. We can also, as psychologists, try to say, how do these factors relate to each other? So we have something like concern, which is a facet of risk perception, and we can say, how does that end up affecting the resulting support for a sooner or later broad PFAS restriction? Naturally, those who are more concerned want a restriction sooner rather than later. But we can also build these pathway models where we look at how things like EUC PFAS acceptance, behavioural intention, and support for policies to reduce PFAS mediate this relationship. And indeed, those who are more concerned are less likely to support the EUC PFAS acceptance, but those who are more supportive of the EUC use cases of PFAS are willing to accept a later restriction. They're less likely to change their own behaviours to avoid PFAS, and they're less likely to support broad policies to reduce PFAS pollution. On the other side of things, those who are more concerned are more willing to change their own behaviour. They're more willing to support policies to reduce PFAS pollution, and indeed they want a restriction sooner rather than later. So this is just a preliminary analysis of how we can start to add in factors that help to explain differences in these pathways between these factors to the resultant outcome of policy urgency support. In terms of covariates, I think there's a few really interesting things coming out here. So we can look at age, and we see that older people tend to generally accept the use of PFAS in those EUC use categories less than younger people. And also, older people are more supportive of general policies to reduce PFAS pollution. And actually, when we kind of look at written responses across the project from older respondents, we see messages like, well, I remember a time when PFAS wasn't in every product on the shelves, or I remember a time when we weren't, reliant upon PFAS in batteries, etc. And I think that's a really important narrative to put across, because what can seem right now in the moment essential hasn't been there in the kind of wider scheme of things. It's a small blip in human history. And I think there's an important narrative from older populations on, things that we do and don't need being looked at in the grander scheme of things in a longer timeline. Political orientation is another interesting one. So we see that more right-wing people tend to accept the EUC use cases of PFAS more. and they're less likely to support general policies to reduce PFAS pollution. Now, political orientation is something that comes out as quite divisive in a lot of climate issues, environmental issues. And what we're seeing here is this general effect of the more right-wing people tending to support the status quo because they do not like a change that they see as affecting them without them accepting it. And also they are less likely to support anything that they might feel would lead to economic disruption. So what might be important here is to tailor communications towards more right-wing people, the resultant costs of PFAS, not dealing with PFAS, allowing PFAS pollution to go out at the current rate, making them aware of the greater costs of that compared to the current economic gains that we might have in the short term. Lastly, I think it's important to mention trust in authorities. So here, generally, people with more trust in their authorities were more likely to accept the EUC PFAS use cases. And I think it's just an important point that if you don't have trust, it doesn't matter what your policies are, people will not believe in them and support them because they won't believe they're effective. So we need to keep a two-way street going in which, it's a dialogue between the institutions and the public in order for them to have trust in authorities to support policies. So to summarize, I think what we see overall in our work is that what people need can vary by region and by person. In this, the acceptance of what is needed to meet those needs can also vary. Broadening the definition of essentiality, as we did, can help to kind of initiate public discussion, but ultimately there needs to be a greater understanding of PFAS and also the circularity of the problem. The EUC criteria remain very complex. We didn't see clear winners yet in terms of what a demographic, if we try to use this sort of democratic approach, there isn't a clear winner. Perhaps making it more tangible for a range of people could provide some validation in that sense. And lastly, I think framing is really key. So, lots of things can make a product essential to people's lives, but that doesn't mean that they want PFAS in them. So we need to control the narrative. It's not just, is hygiene important to you? Yes, end of the conversation. It's hygiene is important to you, sure. But once, but what level of performance do we need once you know the risks in place of PFAS being in these products? I think it's important we go and do the additional work where we inform people. In terms of limitations, there are lots. Primarily, we're targeting consumer uses, and this is because we want people to think about where they have come into contact with PFAS in their everyday life, because that proximity can really get people, engaged with an issue. But naturally, as well as kind of addressing the bigger circularity issue of PFAS, that as long as it's produced and disposed of, there will be emissions. We also need to make people aware that it's, main tonnage is coming from industrial and professional applications. So just banning consumer uses is not a good solution in the long run. Despite these limitations, I wanted to finish with a nice quote from the EEA Late Lessons from Early Warnings report, wherein they say that we need to ensure the use of lay and local knowledge, as well as relevant specialist expertise in the appraisal, if we are to come up with solutions to problems that work well for the majority of society, and if society are to understand why we are justified in doing that and to support it. So thanks for listening, and I'm looking forward to your questions.
ZeroPM, Zero Pollution of Persistent and Mobile Substances. This project has received funding from the European Union's Horizon 2020 Research and Innovation Programme under Grant Agreement number 101036756.